How to treat facial aging non-surgically. Let's go over this together. Basically, what's happening as we're aging is this bone, which is the zygomatic bone, is not just melting away through osteoporosis, but it's also rotating inferiorly. And what that does is that diminishes that malar mound. So what can we do to rebuild this malar mound? Let's talk about two non-surgical treatments. The first is something that's very well known to all of us, and that's filler. Filler is a hyaluronic acid, and that can be injected. And so we will depict filler in blue. If this area is getting smaller and we're losing that malar mound, we can inject filler into here as either a bolus or as in threads to volumize this, to build up that cheek and give you more of a malar mound and effectively build on top of the bone that has become malpositioned, rotated inferiorly, and become smaller. And so you can introduce the filler into here and you can put volume right into that cheek over the malar bone and create an increased malar mound. Non-surgical option, very, very effective, probably one of the most commonly done procedures in the non-surgical aesthetic community today. It can be done by a nurse, it can be done by a surgeon, a dermatologist. Virtually any medical provider can perform this technique. Now, let's talk about a new innovation called the Silhouette Instalift. So the other option to malar mound elevation is something called the Silhouette Instalift. Very effective way of non-surgically lifting the malar mound. So effectively, what we're doing with this is we identify that the malar mound has decreased because this bone has gotten smaller through osteoporosis, and also a great paper that just came out demonstrates that it's actually rotating inferiorly, making this malar mound smaller. So how do we grow this malar mound and rotate this tissue superiorly? We use the Kahn technology. So let me demonstrate. There are two needles. One enters here and goes inferiorly. The second one goes here and goes superiorly. The needle is introduced directly over the malar mound. So it would be entering in here and deployed inferiorly, coming out of the skin down here over the nasolabial fold. These cones are unidirectional. So as they go in and then you pull back this way, they lift this cheek tissue up. Then you similarly enter with the other needle, and this black area here demarks the needle. The red is the thread. So the other needle is introduced here and advanced superiorly and then brought out of the tissue. And then you pull them together like this, and that causes all the tissue to come together and creating a higher elevation of this malar mound. So again, this is doing the same thing as injecting a filler, but instead of volumizing out or filling out as a filler would do, this is bringing together and mounding up the tissue using these cones. Now, the interesting thing about these cones is they are absorbable. This is not a permanent treatment, but a temporary treatment. These cones take about 6 to 9 months to dissolve and go away. And then when they do, they build more collagen. So not only are you getting the lifting effect, but you're also getting the building effect. And often we'll use about anywhere from 3 to upwards of 8 of these per side to lift and elevate the malar mound. Again, so this is a non-surgical treatment for addressing the involution of the malar mound and the inferior rotation of that cheekbone. It's a very effective way to very quickly, non-surgically, the whole procedure takes about 15 minutes to a half an hour, as opposed to a filler, which may take 3 to 5 minutes to inject. So these are very, very short procedures. They don't take very long to do, but they can have long-lasting effect for several months. And this may be something that you do in place of a facial procedure or even in preparation. Some patients come in and say, Dr. Claytor, I'm not ready for a procedure. I'd like to get one in 3 to 5 years. What can I do to bide my time and get me through this? I have some patients who come in, they've got a wedding coming up in a very short period of time and they'd like to do this treatment. This is a very, very effective treatment for very quick intervention that is a short duration in terms of lasting several months. Non-surgical treatment for malar mound elevation in response to the zygomatic bone decreasing in size because of osteoporosis and also because of rotational changes that happen as we age. I hope you found this helpful. Thanks so much.